Hello, dear colleagues. Today we plan to treat the patient with multiple problems. And the patient had a stroke in PCA territory 2 weeks ago. Some infarction. And on DSA, the territory is normal, but patient had a stroke, and on diagnostic angiography, we see the critical stenosis of orifice V1 segment on left vertebral and incidental aneurysm of the basilar and superior cerebellar artery junction on the right side. Aneurysm is 1 millimeter and 2.5 millimeter. And right vertebral artery is occluded. Might be it was the source of stroke. Some collateral filling of the vertebral artery, and there is a stenosis of the proximal carotid, internal carotid on right side, and the cavernous segments also stenotic. It's nearly 50% of stenosis. We will follow, and ICA we also follow, because today we plan to stent left ICA. You can see this stenosis on proximal part, and on proximal part also here. And on the intracranial part, we can see small aneurysm in communicating segment of the ICA. Aneurysm is regular shape, and we will just follow this aneurysm. If it will grow, we will treat. And the plan is to do angioplasty for the vertebral artery. Мы сейчас здесь стоим? Слева, да? Okay, the guiding 8 French Hyperion, да? Hyperion in the left subclavian. Judkins right. It's our main catheter. And we took the Camus balloon from Asahi company with the Xeon blue wire inside. Yes, and the age of the patient is 59 years old. He's quite young. Ана ішіндегісі керек. Что сесанс? He's young. Yeah. That's atherosclerosis, and he's European nationality. But I think the fatty diet of our region is one of the common problem of this atherosclerosis. Okay. I need to keep the way to the vertebral artery. That's why I will try to straighten the V1 segment of the vertebral artery. We'll try to put the protege stent for the future embolization of the aneurysm of the basilar. Today we will do just treatment of the stenosis. Okay.
да, в чем-то.
А потом отрежет. Женя знает, как это сделать. Okay, it's better to take the roadmap from the on geography than regular roadmap. When we, if we will change the position of the instruments, it would be helpful. Так, Smart Mask хочешь? В этом еще. Okay, it's okay. Usually it's helpful and we can straighten the basilar, vertebral basilar. Smart Mask. Назад. Вперед. Ближе, больше. Так, покрути. Все, стоп. Так, nominal pressure of the balloon. Balloon is 3.5 millimeter. Nominal is 6 millimeter. 6 миллиметров. Moral protege verirсеңші? Сороковка. 6, we can do more. 12, 14, 14. Сейчас, подожди.
Гепарин солнечный.
Да, 5000 гепарин.
Скажи 5 тысяч.
Без гепарин.
Гепарин 5 тысяч.
Так, Маратом Ильич надо дать 20 атмосфер. 20 атмосфер надо дать. Зерма атмосфер. Okay, we will give 20 atmosphere. Назад. Назад. 5000, да. Okay. Angioplasty done, and diameter of the artery became more suitable. Квадратор. Now we'll try to go with protege stent a little bit distally, and we'll try to straighten the vertebral artery. Okay, I think okay. It's okay. Так, смарт мозг. Окей.
Оценил?
Мгм. Вот так, наверное, да, где-то. Сейчас смотрю. Бля, ну я ладненько. Answer. Yes, some problem. Retrieve. Забери. Можно выкинуть. М. Окей. Ну-ка, назад. Назад, вперед, назад, вперед. 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 Окей. If you want to compare this one with the previous one, you can see the difference, yes? There is no kinking anymore. Нормально. Я думаю, расширять особо смысла нету. Okay, we finished with the vertebral artery. At the end, I will ask Marat to do rotational 3D in vertebral to see the basilar aneurysm. And now we will go to the left carotid artery. Okay. This is carotid system. Prondır ловушканы бере салшы.
М?
Prondır деген ловушка бар, соны бере салшы. Мұрыл. to straighten the kinking. It was the main reason. As it was a kink, and my main purpose was to keep the access if you treat the basilar aneurysm. It's better when you have a straight artery. Then you create the stent in kinked segment of the vertebral. Second pass could be impossible. It was the reason. Қозғалмаймыз, не шевелимся? Не шевелимся? This is quite new device called Pronder. It's a good copy of Protege, and the difference is at this point some hole. It's made specially. Так, чуть-чуть надо загнуть. When you start the procedure, when the wire is outside, it's better to have this hole. And now it's also okay. Держи, да, Мар? It's a nice copy. Так, смарт-маску надо сделать. Сейчас. Предыдущий. Как сказать? I will put my Pronder here. And the difference between Spider and Pronder, it's fully braided protection device, and it's less creating the spasm in the IC. Yes, it's just opened, and now we'll take out. The same design like Spider. The green side, the blue side to take out the protection system. И Сигард Перес с 40-ка. And for this vessel we will use the Sigard stand 10 by 40. We have no available other sizes this time, that's why the length of the stand would be 40. It's a good option for this segment, and the stand would be 10 because other diameters is not available. But it's possible to put in 6 and 10 millimeter. In 6 millimeter, 10 millimeter. Давай, надувай. Быстро надуваешь до 20 и быстро спускаешь. I asked Marat to inflate very quick till 20 atmosphere. It would be nearly 3.8 millimeter. Maybe I need to take it back to prevent the transitory ischemic attack. Yes, it's okay. I think one more time. The proximal part. Here. 20 и выходим. The same balloon we used in vertebral artery. It's a Camui from Asahi company. 3.5 by 20. And we inflate it till 20 atmosphere. At 20 atmosphere it would be nearly 4 millimeter. Все. Подожди. Всё, хорошо. Все. Так, стенд открыли, да? Assurance. We'll leave it. Maybe we will need it. Now we'll take the Sigard stand. It's Inspire MD company. Oh, Киржиху наш. Inspire MD company from Israel. It's Israeli brand. And the preparation like in Protege stand. The same laser cut stand, 19 self-expandable. With good radial force, but it's dual layer stand. With the polymer mesh outside the stand. And the recommendation is we need to flush the stand and the hub with saline because the polymer mesh is hydrophilic. Извиняюсь. Okay. The patient is stable in position and but I think I need to do angiography. Қазір smart mask қолданамыз. Yes, I can push a little bit forward. Maybe a couple of millimeters. Stop, smart mask. Difference between Protege. There is no more dense markers. Just you can see only the stent. And stent is quite stiff when you push it. The patient is moving. Sometimes it's hard to resheath, but now it's okay. Stent is resheathed. Okay. The blood pressure is 125 by 70. Okay. Не, Y connector сетишь. Y connector. Окей. Чехол можно выкидывать. Я думаю, что... Так, пульс не изменился. The pulse is stable, 78. The arteries became normal. Marat, what do you think? Do we need post dilatation or is it okay? Maybe once, yes? Бред толежник. Okay. sometimes could be problem with this open cell stance when you navigate the instrument. It may stuck at the struts of the stance, but now it's okay. It's okay. Давай. 20 сразу. I asked Marat to give 20 atmosphere. Okay, you can see, and the artery is enlarged till 4 millimeter. I think it's enough. It was critical stenosis, and верхняя часть нормально. The upper part of the stent is normal. There is no need to do anything. Можно выкинуть. Можно выкинуть. Contrast. Now we'll take out the protection device. Держи. Yes, it may stuck. No, it's okay. Let's look okay. Now we will take out the fronder. And then we'll do control angio again. And after that, Marat will place the guiding in. Okay, take out some hijama. Так, капает, да? It's okay. There's some spasm because of the vessel straightening and the diameter of the stent, but it's okay. It will resolve when it lateral projection. Yes, and we need to control the venous phase. Venous phase may show the problems if they are, but now we can see there is normal venous phase. And now Marat can take the lateral tube out. Латеральную трубку можно убрать. Okay. And inside the Кирилл, попробуй нож. Сейчас. Боковой лапки, да? И 3D. Okay. We'll do.
Позвоночной артерии, да?
Да, с подключичной. We'll do 3D from subclavian artery. A little bit more contrast. Okay. Сейчас, Миша, погоди. Okay, now we'll see the 3D. Okay, we'll do new. Deval. Smooth and 512. Yes, there's aneurysm. Yes, there is aneurysm. But the diameter of the aneurysm is 1 millimeter. Okay, we'll order 1 millimeter coil in diameter, and we'll plan this patient for the second session. Okay, and today we have not these 1 millimeter coils. Thank you so much. Now we will finish this case, and we'll take another patient. See you. Thank you. Bye.